Some of us didn't make it into 2022. I know many of you will know we lost a pillar at Joy 99.7 FM. I'm going to play this one for Elvis Kwashi. We are most definitely missing you. And for my year group Moba 81, we lost Ras Bonyo. And I know the team is going to the family now after the burial. So this goes to Elvis Kwashi and all of us we've lost in the past year. We're thankful we're here. Stick and stay.
Joy 99.7 FM. Joy 99.7 FM.
Truly love. Check it out. Seems like yesterday we used to rock the show. I laced the track, you locked the flow. So far from hanging on the block for dough. Notorious, they got to know that life ain't always what it seemed to be. Words can't express what you mean to me. Even though you're gone, we still a team. Through your family, I'll fulfill your dreams. In the future, can't wait to see if you open up the gates for me. Reminisce sometime. The night they took my friend. Try to black it out, but it plays again. When it's real, feeling's hard to conceal. Can't imagine all the pain I feel. Give anything to hear half your breath. I know you're still living your life after death.
Joy 99.7 FM.
Us while we pray for you. Every day we pray for you. Till the day we meet again.
Joy 99.7 FM.
Memories give me the strength I need to proceed. Strength I need to believe. My thoughts big, I just
Joy
can't define.
99.7 FM.
Hands of time. Us in the six. Shop for new clothes and kicks. You and me taking flicks. Making hits. Stages they receive you on. Still can't believe
Joy
you won't give anything to hear
99.7
happen.
FM.
I know you still living your life after death.
Oh boy, I know you're still living your life after death. Puff Daddy and Faith Evans, missing you. To everybody we've lost. Most especially Elvis Kwashi. Wow. Oh boy. That's right. We've got another book to write. 365 pages by His grace. We call it a family of frequency. Not just a program, but a promise. I call it Ultimate Health on Joy 99.7 FM. I've got my squad in the house by His grace. Oh my goodness. Na Shele. Dr. Na. Chiropractor and CEO of Nova Wellness Center. I've got my two pharmacists, Oboda and Sapong from Ad Pharma, crossed over with me. Reverend Osofo Ernest Enim Opari. Oh boy, and on Zoom I've got the wisdom when it comes to diet, wise Lecha. Gentleman, lady, thanks for joining me. Happy New Year.
Happy New Year.
Wow, did my intro kind of make things all sober? Yeah, we lost a big pillar here at Joy 99.7 FM. Manager Elvis Kwashi, I know many families have had to say goodbye to loved ones, so I decided to start this. But we still have the gift of a brand new year, 2022. How have you been, now?
Very well.
Very well. You look it, and I
you.
see our ladies, and gosh, your daughters. We'll fit them in shortly. And my ad farmer gang, pharmacist Obodai and pharmacist Sapong.
You're doing great.
You're doing great.
Very
And how's ad farmer?
Also doing great.
Right. Osofo
Boss.
Ernest.
Boss.
He always says boss, eh? Charlie, good to see you. Looking
Good to
sharp.
see you too. Thank you, my boss.
You guys make me look ragged and
Oh.
casual and old. Wise, can Wise hear me? Is Wise online? No, he's not online yet. We're expecting the dietitian, Wise Lecha. He's with the Trust Hospitals and Clinics. We're taking New Year's health resolutions. Yeah, I know you make the resolutions for your pocket, your finances, the house you want to build and all that. But your health or healthy resolutions, what are you committed to doing in 2022? So I've got a chiropractor or a chiropractic physician. I've got a family doctor, a family health or family medicine physician. I've got 2 pharmacists and I've got a dietitian. I know weight loss and exercise are going to be in there. I know rational use of medicines is going to be in there. And then they'll be sharing how to sit up. Posture points. So that's what we're doing today. WhatsApp is 055 11 11 997. Yes, it remains the same, though we've got a new year, same number, same frequency, 99.7 FM. And of course, we will activate the phone line so you can get in on the show. So let's get it kicking. 2022, it's here. And by His grace, we have it. Osofo Ernest, since you are the Osofo and a physician, interesting combination to have in a crucible, or is it a round bottom flask? So give us your should I say first resolution you want people to look at when it comes to their health.
Yes, so thank you very much for the opportunity. It's always an honor to be on the show, and then Happy New Year to my co-panelists,
You know,
as well as our listeners.
I'm Mr. Speaker.
That arena, I fear.
You fear the arena. We'll get there.
So
we'll
you
get
don't
there.
leave your seat and
Right.
all of that.
You
So-
are the people's representatives when it comes to their health. So
Yeah.
you are MPs in the studio.
Thank
So
you
share
very
with
much.
us. Yeah.
Yeah, so to start with, you mentioned resolutions, and I think you mentioned some of the areas that we need to look at.
Right.
Now here talking about the ergonomics, where it has to do with the relationship between your work and your health. Because
Right.
most of us do engage in one occupation or the other.
Mm-hmm.
And many a time people would forget to know that there's a direct correlation between the work they do, their posture and other things, the demands of the work, and the health outcome, as well as my co-pharmacists who are here who will talk about the need for medication and adherence. So it's a complete team. But to start with, before anybody starts to look at their resolution, my first point is that you need to reflect.
Right.
Without reflecting on your health event or health history for that particular year, you would have missed out on a lot, because in terms of setting targets, even though there are general things that you would have to look at, many a time you'd like to have individualized goals. And so before you can have these goals, you need to reflect on how well you've been throughout the year. And when I say your health, is not just like the WHO says, it's not just the absence of disease. So someone listening will say, oh, as for me, I was never sick the whole year. As for me, I never went to the clinic the whole year. Mm-hmm. Health is the complete well-being of an individual. It is not merely the absence of disease. By complete, I mean the physical, the social, and mental well-being of an individual.
Right.
And so if you are looking at this in these compartments, then you have to find out physically, were there any illnesses that I was diagnosed in the course of the year?
Okay.
Or were there any conditions that I had prior to entering the year? And if I had these conditions, how well was it controlled?
Okay.
Maybe counting averagely, you made 5 or 6 visits to the physician in the course of the year. How many of those visits were you commended for your
So essentially,
control?
go over your own health pink sheet.
Exactly. You
Right.
need to go over that. That's my
Be your
first
own
point.
polling agent.
Exactly.
Did you go to hospital? What were the issues?
Yes.
Right? Have they been resolved? What
Yes.
kind of intervention or
Yes.
management are
Yes.
you on?
Yes.
Right.
Yes.
You must know this.
You must know
and
this.
reflect over it.
And reflect.
Okay.
And then based on it, of course, then you need to do some analysis. So you have to find out if there were flaws. what were the areas and what could have accounted for those flaws.
Okay.
Perhaps maybe you were not taking your medications as frequently, and that led to uncontrolled.
So you're doing your own SWOT analysis.
Exactly.
Strengths,
You
weaknesses,
need
opportunities, and threats.
So
to your
what
health.
were your hindrances in you seeking
I
advice?
love this.
Or was it a situation where you actually went ahead, but perhaps you were not receiving the kind of care you expected? Because that could be a factor. And as we do this resolution, I think some people may have to even change their physicians or the facility they are going to, because
you may
if you
need
do
to seek a second opinion.
Exactly. If you do a good audit and you realize that you did your part of the bargain, then probably you may need a second opinion or might have to change the facility. So my first take home when it comes to resolution, before I share the others, is that you need to reflect on your health record or health
record
for
over
2021.
Right, great. And of course, it may also broaden to include a health record of significant others, family members,
yes,
as
exactly.
they relate to you.
Yes,
all right.
Exactly. That's very important.
Okay, great stuff. You've heard Reverend Osofo Enimopari, right, telling us that go over what you've been through for the year, right? What that tells you about yourself, your body, your health, your well-being, and take stock of that in order to use that to guide and inform your resolutions. If you don't know, I always like to say anything that can be measured, evaluated, can be managed, right? So know what's in your system, your scope, and your experience for the year, and be able to look at that. If you have any concerns, questions, any resolution you want to share, WhatsApp is 055 11 997. We're live on Facebook and YouTube. This is Ultimate Health on Joy 99.7 FM. We're trying to get Wise on. He's just sent me a message. He hasn't received his Zoom link. I'm trying to rectify that. So coming to you, Na. I like it when they call you Dr. Na. You have been so busy this year, right? And the practice is still growing. But if you can crunch it and give us your first tip or resolution.
Yes. What I would say, looking at events of 2021, or let's say even from the pandemic, 2020, we realized that people's work lives have changed. People are working from home. People are working different shifts and hours, and there's a lot of changes.
Okay.
People don't have the right equipment, the right furniture like they would if they were in their offices. And because of all those changes, we realized that there was a certain trend at the clinic seeing patients. So my first take would be move. I also agree with my colleague here about taking stock, So if you take that stock and you realize that you were very stationary, for instance, which is what I noticed. A lot of people were sitting for hours on end, especially those who have the opportunity to work at home. You realize that you have the freedom. You can sit on your couch. You can sit on your bed.
I teach on Zoom and I see a student's toes.
Yes.
I just see your toes.
Yes, exactly.
Right, but you're in class.
You're there. Yes.
So you're saying move.
Move.
Knock
It's
out the
very,
sedentary
we need
lifestyle.
to stop it totally, because we realize that when we don't move, most people are thinking about back pain and headaches and neck pain. But I want people to understand that when you are sedentary, that is when the chronic lifestyle diseases also do set in.
Okay.
So apart from your musculoskeletal diseases, your hypertension, your diabetes, your high cholesterol,
They
all
are
those things,
key bedfellows with the sedentary
it
lifestyle.
comes along with the sedentary lifestyle.
So move.
Would be
Shift.
my first take.
All right, get off your butt, and no buts about that. Okay, right? So move. Your body was made for motion.
Yes,
right,
absolutely.
and activity.
All our joints, if you look at the skeletal human frame, you realize that the body was not made to be stationary.
Okay.
There's cartilage, there's tendons and ligaments, and all these things are there so that your joints can move.
Okay.
But we don't move as much. So all these structures end up being stiff and locked and fixed. And like I said, apart from the back pain and all those things, even your organs, your heart, your lungs,
They need to be exercised.
all those things are affected
Properly.
when
Right.
you don't move.
Great stuff. I mean, we're rolling. It's already 18 minutes past the hour 2, but we're learning. learning to move, review our health history, right, and use that to set targets, right? And I'll come back to the family physician because I know you're not setting the targets in isolation, right? You got to do that with your care provider or whatever. But we'll get to that. Okay. Gosh, I've got Penny and Kakra, the pharmacist, right? Dan and Obodai, right? Yeah. What would you want to hit on? One each for each of you. Then I think we may have Wise on the line. When it comes to our health, resolutions, and I know my listeners, my WhatsApp is active. Send us your resolutions. I know many of you have got a tall list of excuses. Designer excuses for not doing the things my guests are saying and suggesting and recommending. I will head you off with some of those excuses so that you can't even use them. So yes, pharmacists.
Yes, so I would begin with by saying most people who do not smoke,
Okay.
yeah,
Don't even go there.
who do not smoke live 13 years longer than those who smoke. And
13
when-
per.
13 years.
Uh,
Yes,
Okay.
13 years. That's according to the National Institute of Health.
all right.
So I would say smoking is one of the major risk factors when it comes to most of the health conditions, the diseases and all.
Okay.
So I would say smoking cessation, quit smoking.
Right.
Sometimes it's not so easy to quit, but just walk into any good pharmacy, ask to speak to a pharmacist. We have some nicotine products you could actually take that would help you to quit smoking.
All right. So if you smoke, get out of the habit. If you don't smoke, don't even go there.
At all.
I always say tobacco, cigarette is the only product, if used by or according to manufacturer settings, will definitely kill you.
Well,
It's the only product that if you follow the manufacturer's instructions, you will die. All right. So don't even go there. All right. And I also add that if you were designed or made to smoke, then God would have given you a carburetor instead of lungs and an exhaust pipe instead of the rear end.
Yeah.
Okay. Right. So stop those habits. What about alcohol use? Since you've gone there.
yes, for alcohol,
Yeah.
alcohol is also another risk factor.
Okay.
So we advise people to also quit alcohol.
Okay. Right. I'm told Wise is on. Yeah, he's on now. Uncle Lecha, F1. F1. I know, is it F1?
My fault.
Okay, it stops there. The airway stops there. Great to have you and Happy New Year.
Yeah,
And-
I'm happy to be here too. Happy
Right.
New Year to you
Yeah.
and to my colleagues in the studio.
Right. Now, just share with us quickly, dietary discipline is a must. But if you were to hit your number one, what would you be hitting for my listeners and my guests as well?
Yeah, this is actually coming from our listeners. Over the years, weight loss has been number one on top of the list of resolutions. So what do people want to achieve in the new year? At the beginning of the year, they want to lose weight. There's this renewed energy and feeling of possibility and
All right.
vim and everything that people believe that once the new year begins, they can work on their weight. That's number one. And then closely related to that is the reduction in pot bellies. So mostly men believe at the beginning of the year.
You mean, hang on a sec, why? So weight loss, okay, I get that, right? But then you go straight, number 2 on your list is pot bellies. Seriously.
Yes.
Okay,
Yes.
hit it.
So this mostly seen among men or our male clients or listeners.
You are afraid of the women. I've seen women with pot bellies. Can you hear? So let's leave it at pot belly, but say what you want to say.
Yeah, so this is just the beginning of the year. People believe that they cannot continue not being able to wear their old clothes, etc. So it's time to work on it.
Okay.
And they have this energy, this renewed ability to just start working on their pot bellies, and at the beginning of the year. And the third on the list is exercise. During the festive season, people enjoy a lot of holidays, and they forget about exercising. They forget about eating well. So usually they come to the clinic even with their problems getting worse, blood pressure, blood sugar, weight rising, etc. So at the turn of the new year, they begin to set goals for exercise, and
Okay.
that's always part of people's resolutions.
All right, I'll cut it there for now. I'll come back to you. So weight loss, lose weight, right? I might come back to you on the how. I'm curious though. What is this new found vigor? Belief that people can actually do things they hadn't done during the year. I mean, you've had 12 months, 365 days, and then you cross over, step over, dream over, or whatever you do, and then suddenly you believe you can and you will be committed. As somebody, and I'll ask my other guests in the studio as well, but is there anything that, or is this just a screensaver? Are people really energized, reinvigorated, and serious about targets as we speak about them? If you haven't been able to manage your weight over 365 days, and then today on the 2nd of January, because Nortey by nature is talking, what changes and what would you advise to keep this motivation or this momentum at its peak?
Yeah, so it's just the feeling that comes with the new year. And as practitioners, we must cash in on that feeling, that belief that people have. And that is where we are advantaged. So when we sit in the clinic, we are able to just help people plan and do the right things so that they can keep it up, try to work on these goals. Even though at the time of measurement, that is like mid-year, getting to the end of the year, a lot of the time people are not able to achieve these lofty goals that they set for themselves. But then you see them beginning to do something about these things at the beginning of the year. And as practitioners, I think it's just a good time to give them some good information, which is key to dealing with the problems.
All right, great. You've heard some wisdom from Wise Lecha. He's a dietitian with the Trust Hospitals and Clinics, and he also has a private practice, and he's a publisher, an author, several books on dieting and being your own dietitian and all that, sharing wisdom. Lose weight, exercise, break that pot belly, flatten the curve, right? as they say. But we'll get to the hard facts of it. You can share your WhatsApp 055 11 11 997. We're live on Facebook and YouTube. This is our first program this year, and you can see we hit the ground running. We really want to make an impact, not only to inform but to transform. So we're hitting your health resolutions for 2022. Feel free to share yours or your failures, and maybe we'll be able to assess your failures and why you couldn't do what you wanted to do. Review your health history over the year. I'm sure COVID will come in at some point. I know people are playing a lot of hanky-panky. They are freaking enjoying, partying, and they see the numbers. It was we passed 10,000, right? This is the highest we've been if I look at the graphs. Right, so COVID is in there, must feature in our resolution somewhere in there as well, because we're still working. Our workplaces are open. We're collecting salaries, and we don't even think about a lockdown or any change in that status quo. But I know what it was like when we're locked down for about 4 weeks and so, right? Mm-hmm. So it must feature there. Share yours with us, 055 11 11 997. Okay, so we've got some of these. Let me come back to you, Dr. Enimo Pari Osofo. You talked about reviewing these things. Nas mentioned move. And I know I spoke to you earlier and you emphasized and highlighted setting goals. Who do you set the goals with? Some people set the goals when they are in the shower and they are, they talk to themselves. But how do you set these goals? Who should you be setting the goals with? Your physician?
Yes. So to start with, it won't be bad to set out the goals yourself.
Okay.
But as a practicing family physician, the good thing is that there should be an initiative from the client or the patient. So, for instance, having started from a reflection, you would come to a point to say, okay, my blood pressures were so high, I'd love to have a reduction. Or my blood sugar was not well optimized, so I'd like to have a much better control over my diabetes.
So you actually set specific targets for blood sugar, BP, and so on, and then you can know if you have deviated or derailed.
And like the acronym goes, it should be a SMART goal. It should be specific, it
Right.
should be measurable, it should be attainable, it should be relevant, and time bound.
Time bound.
And the good thing is that we are in a new year, so it gives you that luxury of planning. Maybe you can do first quarter. It doesn't have to be a goal that goes through the whole. You can give maybe a 25% reduction in my weight by June,
Okay.
that kind of thing. But you asked who should be involved. The first person to be involved is the listener tuning in this afternoon,
Okay.
or the patient, or whoever is listening to us.
Right.
And then you need to have this discussion with your doctor based on your previous history, because sometimes you have somebody say, okay, I'm weighing X, or I'm weighing 85, I
Okay.
want to weigh 60 by this time.
Right.
It may be a good goal, but it may not be realistic.
Realistic.
And it may not be attainable within the time
So in this
frame.
specific instance, alongside your dietitian and so on, they can
You-
tell you how to tune it, operationalize it to be
Yes.
realistic
Yes.
and also safe.
Yes, and also so that,
Right.
like you said, safe, so that you do it without any adverse effect,
Okay.
because you want to build a certain motivational change that would become your lifestyle rather than a drastic drop.
Right.
And so, sometimes
Not
okay,
a
somebody-
one day
a
wonder.
exactly,
Right.
and then you would have maybe somebody who had high cholesterol level,
Okay.
and say, okay, this person said the cholesterol was so high, did this and that, and so the cholesterol is now low. In addition to the goals being SMART, being specific, measurable, attainable, realistic, and time bound, it has to be individualized. So somebody's BP may have been 180. And this year, they don't have to, even though we know the optimal BP should be
Right.
about 130 systolic, we are not in a haste to get there, because if you drive the person to that point straight, the person may engage in other things which may not be sustainable.
Okay.
There are some conditions, for instance, if somebody suffers a stroke immediately and the BP is around maybe systolic of 190, 200, or even though you would wish for the blood pressure to be lower, at that material point in time, it is not a good thing to see a drastic
Right.
reduction. So you need to set your goals and then see the physician and say, these are my goals.
Okay.
How do we get there? Are they, what do I say? Are they reachable? Are they realistic?
Okay.
And then we look at ways to get there.
So you're working together
We are
to get
working
there.
together,
You're
because we
walking
also-
the talk.
Yes, and we don't also
Right.
want the case where the physician sets out for you. That is also not right, because
Okay.
it becomes a paternalistic relationship.
So you want to
where-
take ownership of the goals
Exactly.
because
So-
you were party to them.
Exactly.
Right.
It should come from you. And I just
Okay.
wanted to ask something about the question you asked about weight change, especially at the beginning of the year.
All right.
It so happens because many a time when it comes to motivational change, it goes two steps. And many of these people who decide to take this action might have been in stages of pre-contemplation, that is maybe without any necessarily
Agree.
exactly. So you're not sure, and there may be at the turn of the new year, they think it's time to act. And like Mr. Lechat Riley said, you need to move on in the stages, because
Okay.
if you can stay in pre-contemplation without necessarily going to planning, because usually it starts from pre-contemplation.
Plans you don't actualize will haunt you.
Exactly.
Right,
So
you look at yourself in the mirror and say, "Where, Minnie?" Right.
Yes,
So
so-
you must move from contemplation to actualizing your plans.
Exactly.
I have three things I say: I can, I will, and I have.
Okay.
It is only when you arrive at I have
Yeah.
that you have something to measure.
Yes.
Right.
Yes.
Okay. So stop speaking. Your results will speak. Right. So Dr. Enimo Pare is saying, actualize these plans, make sure they are SMART goals, and work with your physician.
Exactly.
And
Very
sometimes you
important.
need co-motivators. It could
The
be
family.
Yeah, the family.
Yes.
It could be your wife, your partner, and so on and so forth. Work colleagues who sustain the motivation
Yes.
over time. Great ones. Right, I got a couple of things. Good afternoon, Nortey. Thank God for keeping you to cross over. My only resolution is to get enough sleep. Okay, that's a great one. Ajiman Joseph in Community 9 Tema, aka Ajingo the man. He doesn't tell me what he does when he doesn't sleep. There's something keeping you awake, and if I was analyzing that with you, I'll be checking that out as well. All right, Happy New Year, Nortey, and your panelists. One thing I have always wanted to clearly understand is generic drugs. Please, people say generic drugs are fake and cheap. Oh, here we go again. So why do they produce them and sell them? Are there not health risks? This is from Mike in Adenta. I'll get my pharmacist to talk to that. I've had to explain that before. Please, greetings, Nortey Dua and Ultimate Health team. Happy New Year to you and your crew. We receive it. Happy New Year to you. Thank you for the authentic, excellent delivery always. God bless. Pass Solo, Doma Ahinkro. Probably Dr. Lecha has gone to Umofia. Hey, Pastor you. Okay, today I have my professionals in the studio. Last week I had the comedians. Make no mistake, we are serious today. Yempe rough. All right, good afternoon. This is for Nadu. Okay, Wish Richard Atreku Jr., the retail manager of GCB Agona Swedru branch, a prosperous year. I believe now has done that already. Okay, great stuff. So we're waiting these things. Fake and generic. I wonder how briefly we can do that. Which way? Okay.
All right.
Uncle
so,
Sabo.
Basically, they are the same.
Right.
Okay. The effectiveness is the same.
Right.
The brand drugs are usually the innovator brands.
Right.
Those who made the drug
Yeah,
first.
you made it. You brought
Yes,
it out. That's
exactly.
yours. Yeah.
Then you get some number of years patent rights
Mm-hmm.
after which the generic ones can also come in.
Okay.
So the effectiveness or the efficacy is the same.
And they are licensed and tested just the same.
The same.
Right. Okay. But the person who brought it out, right, sells theirs a notch higher. Okay. So that is exactly what it is. They are not dangerous. Right, they give you the opportunity to get it at an unpatented price, right? So that's the important thing. So, for example, when we changed our malaria policy, right, there were certain of the combination drugs we couldn't produce here because they are locked by certain things, and then you get lower tier generics that you can produce and so on and so forth. So they are not fake. They do protect you. Thank you for that snappy one to that. Okay, Antina, you said we should move. Okay, right. My movement, you may have noticed when I was doing my intro and attempting to sing, right? My chair suddenly zoomed downwards and I adjusted it again. So the ergonomics that govern my movement, especially in the workplace where you tend to spend more time. When you ask me to move, should I be making and setting these targets and goals in line with or in collaboration with my employer? Who should have a stake in my health and well-being?
Sure. So, yes, I strongly recommend that companies, or when you come down to departments or sections of a corporation, there should be policies surrounding how long people are sitting for.
Okay.
For instance, what type of furniture they would use and things like that, depending on what type of work
Great.
they're doing.
Okay.
Is their chair, table, computer suited to their body height, their body weight?
Your employer is obliged
Yes.
to secure
To
these
make
things for
sure
you.
that all these things,
Your work
are
should
in
be safe.
place. Yes, the workplace should be safe.
Okay.
How are you sitting to work, for instance, or how do you go about your activities? Let's say you work in a factory, for instance, and your work entails a lot of bending,
lifting.
lifting. How
Right.
are you doing these things?
Okay.
Your employer, your supervisor should be interested in how these things happen, because in the long run, there's something we call repetitive motion.
Okay.
If you're doing these repetitive things, whether it's lifting or it's typing or it's arranging, and you're not doing these things properly, safely, especially as a chiropractor, I'm concerned about the spine. So if you're not making sure that you're keeping your spine in its optimal position throughout these activities, and you plan to work for 20, 30 years, for instance, the wear and tear that you're going to put in your joints or on your spine.
Okay.
By the time you finish your work life, which is the 20 or 30 years, you're going into retirement when you're supposed to be enjoying, then you start to deal with spondylosis or degenerative diseases and so
Okay.
on and so forth. But the truth of the matter is, it started maybe 20 years ago. And that's why your employer or you yourself should be very, very interested in how your ergonomics or your workstation is set up,
Right.
so that you're working safely.
And of course, once your employer has provided these ergonomically selected and recommended pieces of equipment,
then it is your responsibility
to use them properly. You've been given goggles, you're welding, and you don't wear them.
Exactly.
You don't wear safety gear and stuff like that.
Yes.
All these are things that we should commit to.
Absolutely. And I always tell people, you can get the best chair, for instance, but if you're sitting in that chair for 4 hours straight without getting up,
Okay.
that's not your employer's fault that
Okay.
you didn't take a break. So every 45 minutes to an hour, you can get up from that perfect chair walk around a bit, do something else, stretch, come back and continue your work.
Okie dokie. Oh yeah, Inafenya, thanks for welcoming us to your home, and Happy New Year to you. I'm glad you're tuned in as usual. Hi, Brad Nortey, good tidings. 2 issues or questions. Whatever food I eat of late, I become somewhat weak after an hour or so, or later after. Please, what's wrong? I'm 50 years old. Second question, I do experience quite severe bitterness in the mouth and cough, dry and incessant cough, occasionally accompanied by pain in the chest and occasional dizziness. Been to the hospital a number of times, but no malaria or typhoid. What's wrong? I was just reading some deviations in the Omicron and some of the new symptoms. Not that I'm saying you have it, but it would be good and worthwhile checking it out in these times. What you're saying, coughing, incessant dry, pain in the chest, occasional dizziness. There's no malaria, typhoid. I've had to ask a couple of people in the past 2 weeks to go and test, and I'm sad to say a couple of them were positive for COVID, right? And they were smack gobbed shocked. They're like, how? Right? So do check that out. But Ernest, you were nodding. Is there anything you want to say to this question?
I agree with you, especially during this pandemic, because it's so classic.
Okay.
Even though it may not look specific, these
Right.
symptoms are very classic. General body pain, and the number of people I've seen without a positive malaria test
Right.
and yet feel unwell are overwhelming. And many a time when they go ahead to test for COVID, like
Right.
you said, it's usually positive.
Okay.
But having said that one, especially the dizziness may be caused by other things that needs further evaluation.
Okay.
It may be related to the ear, it may be related to the position, it may be related to the blood pressure.
Okay.
So like I said early on, it will be important to seek alternative opinion.
Okay, great. Right. Feeling weak after eating. Immediately 1 hour or so after eating, feeling weak, irrespective of the food they eat.
It's not straightforward. I would
not
need
a-
more.
All right, okay,
information.
hang on. Wise is on. Yeah, Wise.
Yeah.
Share the wisdom.
It's not a natural. Yeah, so there is not a natural occurrence that after food you should feel weak. So, like Doc said, I think the listener has to seek a second opinion, go to another hospital and get tested properly. Perhaps the doctors will be able to find out what is wrong with them.
Okay, right. Wise, I had a list from you. I'm just we're fast running out of time, and I also want to activate the phone lines. Indeed, Abek, let me do that. 0302-216-541, 0302-216-541. We're live on Facebook and YouTube as well. Right, so, some of these things, you talked about pot belly and stuff like that, but weight loss is a big one, and exercising. Of course, both of these contribute to preventing lifestyle diseases. But the weight loss, can you hit on specific things that you want people to do? And do they need a dietitian to do that?
Yeah, 100% sure, Banker. If you want to lose weight, you need someone like me. So you need a dietitian. And I say that the assessment has to be done. So when you are at a time like this that you want to work on your weight, you have to get your weight checked.
Okay.
Get your starting point.
Right.
And then write it somewhere so that you know that 1st January 2022 you were weighing so and so.
Okay, baseline.
So that by mid-year we'll be able to have a frame of reference, right? So get the right assessment done. You have your pot belly measured, you have your body fats measured, etc. And when you visit a dietitian, you have all these basic checks done. And you must also plan. And as part of the planning, you must gain the appropriate knowledge. So you don't lose weight by, say, deciding to fast, by deciding to drink only water, by doing the wrong things. No. By drinking certain concoctions. No. You must be on a healthy diet plan, and that is what a dietitian will do for you.
Okay.
Then you should also get a proper exercise regime in place, so that something that can be workable. Exercise that I have seen over the years to work is not the hardest, but is the most consistent. So if you are able to get up often, Dr. Na advised earlier that we should get out of our seat or our chairs.
Okay.
And then if you have even a simple walk exercise regime in place, that takes you about 30 minutes, and you do it every day or most days of the week, you'll be able to lose that weight compared to someone who goes for maybe to climb the Green Mountain and spends like 2-3 hours only once a week. So get a proper exercise regime also in place, and I believe you'll be on the right path when it comes to losing that weight.
All right. Okay. I will promise you a whole program on pot bellies, so we won't go there.
Yes, just
but
to-
the gentleman who sent, I'm coming, pharmacist. The gentleman who sent the issue about the symptoms says he's fully vaccinated, and this is something we want to hit on. Listen, the vaccination will minimize your chances of severe, experiences, right? But it is not a protection, and people are dropping their vigilance because they are vaccinated.
Yes.
Enes, you want to talk about
Yes,
that quickly?
yes, like you said, I think you just hit the nail right on the head. So, vaccination protects you against more severe forms of the disease, one, and also many a time, including death, severe forms of the disease, including death.
Right.
And being fully vaccinated does not mean you cannot get the infection.
Right.
So, and
having gotten it, it does not mean you do not continue to transmit.
Exactly.
Right.
And in some jurisdictions, I think what the one of the biggest problem we have is that every country has their own way of putting across measures to control this pandemic.
Right.
So if you look at the UK, for instance, public spaces like the stadia, they still allow people with or without mask.
Mm-hmm.
But they have a way of making sure that people have been vaccinated. It doesn't mean they cannot pass it on.
Right.
It's because that is the approach they have taken.
Okay.
So I think, just like you said, we should all be careful.
Be careful.
Yes.
Have yourself checked, okay? This is Teacher Saddam. We're grateful you share with us from Dedukope Bato. Right. I saw something else. Just Happy New Year, Nortey Dua. Our diets are full of oil. I have been trying to avoid these. Okay, I won't mention the brand oil, but it's not working. And I sit for 7 hours working, and I have a 1 hour break. Am I on the right path as a young man? This is from Douglas in DC. Douglas, Happy New Year. I got your message. So oil, he's talking about that will go to our oil and gas man, Wise. But he's also saying he's doing 7 hours now. And just before the two of you come in, you wanted to add something. Yeah.
Yes. With regards to Teacher Saddam,
Right.
he's 50 years.
Yeah.
If he's taking antihypertensives, some certain medications causes dry cough.
Okay.
So he should check the particular kind of medication he's taking.
All right. So it
That
could be
could-
iatrogenic.
Yes.
Right. Caused by a medication.
Yeah, caused by medication.
All right. Okay. On the offside, yeah, check. Right. I always say check and eliminate and be sure. You also wanted to add
And then in
something?
relation to the weight loss,
Yeah.
Sometimes most people think starvation or by starving, which means that they are going to lose weight.
Alright.
I think they have to really get that concept, because
Okay.
that could also end you up with ulcers
Alright.
and all that. Yeah,
Be
so-
sure what you're doing.
Exactly.
Make sure you're doing the right thing. I've seen people investing in waist trainers. Now I want to talk about that. The women who are wearing WBC belts under their clothes and all that. It gives you a trim figure. But Charlie, are you breathing? Are you okay?
No.
But Charlie, people are making money. They are selling these
Yes,
things.
but there's no
Are you wearing one?
evidence. No,
Don't mind me.
certainly not.
Right.
No,
They've
there's
tied themselves up so tight for the whole day.
there's no evidence that shows that these waist trainers is what
Really?
would burn fat or make you
Mold you.
slim, or it may make you look
So it's
slimmer.
cosmetic.
Yes, so it will make you look slimmer. It will make you look more trim
Right.
in the midsection, but it's not taking place. It's not taking the place of
You're
your
postponing the problem.
exercise routine,
Right.
or you're going on a diet that will reduce the amount of fat or adipose tissue that you have.
All right,
So,
gentlemen.
yeah.
When you hold a woman, please check her. So she be catch and say, Dr. Nasi, and fat, do the right thing.
Yes,
Get the
yes.
exercise, get a healthy lifestyle,
Right,
which
right.
is consistent. And I heard Wise hit on the word consistency. But
Sure.
Wise, Douglas in DC is worried about oil.
Yeah. So Douglas is in Dansoman. You should just check into our clinic there and see a dietitian, Trust Clinic at Dansoman.
Okay.
We'll teach you how much oil you should eat. You know, oil, we bastardize it so much, but then it's an essential nutrient. So the body needs some oil.
Okay.
Just that we have to work on the portions. But if I don't know your weight, your height, and what is happening in your system, I cannot advise you on how much oil you should eat. So it's not just about trying to reduce it. You need some guidance. That's why I'm showing you your next door to you. There's a clinic that can help you. Come, we will take you on and then put you on the right kind of diet.
Okay.
And then the issue about skipping meals in a bid to lose weight. It's actually one of the ways to make yourself gain more weight, contributes more to weight gain in the long run. Apart from the ulcers that my colleague pharmacist spoke about,
Okay.
you end up slowing your metabolic rate if you are fond of skipping meals. And that will make it harder for your body to burn fat. So you even see yourself not eating so much food, but your weight will not be coming down. So regular meals are required, breakfast, lunch, supper. But again, we work on the meal portions. How much of the kenke should you be eating? How much of the banku should you be eating? How much of the fufu should you be eating? We can eat all of these things and still manage the weight. Just about getting the right assessments done, having the right interventions made, and then adding on exercise. We'll be able to achieve our weight loss goals.
All right. We used to say keep a diet diary, bite it, write it, right? Bite it, write it. Know what you've taken in. Don't walk around and you've eaten 3 times and say, oh, and I mean, did you? Right? Bite it, write it. Be accountable, and then you can now start to measure what you manage what you've measured. All right. Do we have anybody on the phone lines? 0302-216-541. 10 minutes to go. Good afternoon, Nortey. Happy New Year to you and your guests. I was diagnosed of lumbar and cervical spondylosis after falling down in the bathroom. I've done everything the specialists have advised and me to do, but it's not working for me. Now my balancing is not good at all. I walk with an aid. Please help me go back to the real me. Clarissa Bigmos Wallace. I love that name. Clarissa Bigmos Wallace. Man. Okay. But she has a problem. Who should she be seeing now?
She can see a chiropractor. If she's losing balance, we may have gone from spondylosis into neuropathy. There could be other things that may be going on. There could be complications that may have developed over the period. So she can see a chiropractor who would look at the scans, any MRIs, X-rays, any diagnostic scans, to really figure out exactly what is going on and then provide help for the spine.
Good thing is because she sent us WhatsApp, I can see her number. We'll see how we can bridge, right? We do that from time to time.
That's fine.
Ed in North Carnation, I have business with you. I broke the communication. He also sent something a couple of weeks back. I'm trying to follow up on. Yeah, I have a caller on the line. Hello.
Hello, Uncle Matthew. Good afternoon.
Hey, good afternoon. Ajiman Joseph.
Yes, I was.
I'm not your uncle, but you are welcome.
Yes, you are asking why I sleep. Sometimes the weather condition seems to be bad. But I'm doing something that I need to keep it on because what might be causing it.
We're not getting you clear. You're doing certain things. You are trying to account for why you don't sleep.
Yeah, and yes, because of sometimes I need to leave my phone on. They will be calling for assistance and all those things. And I also want to recommend, I think you have an ergonomist in your studio.
I have a chiropractor, but go ahead.
Okay. She's hammering on workplace safety. And I think every company needs this an ergonomist. Whatever she's saying, perfect.
Okay.
And I know some certain food skip meals, and now they end up with ulcer. So I think this afternoon we have with great deal of this.
Thank you. Right. He says he has to keep his phone on. They keep calling him from work and so on. I hear him often mention he's at the port or wherever, right? But these are things we need to look at, our gadgets and whether we have space for sleep and stuff like that. I'm glad he brought that up. Sleep is an important thing. Getting the right amount of sleep and rest and making sure that it is restorative sleep. So we'll see if we can patch through to Clarissa. To help her. Was there any other outstanding issue that any of you wanted to comment on whilst I scroll quickly Yeah.
I think it was related to what the caller just mentioned about the 7 hours and then working for 7 hours and taking an hour's break.
An hour's break, yeah.
Like now said, the break is important, but it's even more important when you take it. What do I say? Intermittently.
Right.
So you don't sit for 7 hours and go for 1 hour break.
1 hour.
I think the last time I was at work, sometimes work pressure makes it difficult.
All right.
But you can insist. There are times when you shouldn't go more than 2 hours without getting out
You
of
should
your
move.
seat. You should
Get
move.
out of your seat.
Yes.
Okay.
So it's so important.
Great. Happy New Year. Pray tell me how many people can afford, this is from Dede, Maryland, Afishapa Dede, can afford a dietitian. Can diet and exercise reduce a pot belly? Isn't it said that pot belly is caused by fat deposits? Dede in Maryland. Wise. I was about to say goodbye to you, but answer this one before you go.
Yes.
So diet and exercise and pot belly.
Yeah. I have reduced so many pot bellies over the years,
including
using diet and exercise. Anytime mine wants to come up, I use diet and exercise to kill it. So it's a possibility.
All right.
And there are dietitians available in the country. Most regional hospitals have dietitians. You just need health insurance. You'll be able to assess them.
Okay.
If you come to the private hospitals, we are also there. So it's not difficult to find a dietitian down here.
Okay, great. Wise, your books and things are available online. Can you give your web address so that people can access that resource?
Yes. So 0244 090262. 0244 090262 if you want the hard copies.
Right.
But then you can also download them from the Google Play Store. You just have to key in the titles. Live long by eating well, eating to prevent and manage lifestyle diseases, and then be your own dietitian. You can download them for just 5 CDs from the Google Play Store.
All right, great. You're so well set up, and thanks for joining us this afternoon. I have a caller on the line. Hello.
Hello.
Good afternoon. Thanks for waiting.
Yeah. Happy New Year.
Happy New Year. Who am I speaking to, please?
Amy from La Paz.
Say that again, please.
Amy.
Amy, from where?
Yeah. La Paz.
La Paz. Okay, share with us quickly.
Yeah, it's about my joint. I realized I have problem with my joint. It started with my fingers, and I always get this relief. They said to like. Then of I had they said adhesive capsulitis at my right shoulder.
Adhesive.
So I'm just wondering, moving from tiny joints now to the big ones, what am I doing wrong?
Okay. Right. So Amy is saying she has problems with her joints. Okay. Now she's scared it's moving to bigger joints. She's been told she has adhesive something. I didn't catch that. Okay. But is this, should I say, a potential client?
Sure.
Right.
Sure.
She'll need to bring her medicals?
Yes, it could be arthritis. It could be different forms of arthritis, that is. So some evaluation process would have to be done to figure out exactly what it is.
All right. Amy, you can call after the show and give your number to Abeku. We'll see if we can hook you up. We make no promises, but definitely we'll put in the effort. Right. If the vaccine doesn't make my immune system in any way, what are the real reasons someone would be encouraged to take it? You can ask those we've lost in the past couple of years, right? Maybe they'll give you an answer. Already people are paranoid, so to learn that is really not protective. I don't agree with you that it is not protective. There's empirical evidence that it is protective, and it has made a massive difference in what we're dealing with, right? So, and what's the meaning of herd immunity we always speak about? Are we saying, look, there are a number of vaccines you've taken already that are protecting you. You haven't asked questions about that. This is a pandemic. So I see the name. No, I don't see a name. I'll get back to you. I'm willing to engage, right? I'm definitely willing to engage, but I am definitely a vaxxer. And I know why we are around, okay? There are babies around that are around because of vaccines, okay? We're doing great stuff. We've got the vaccines. They will expire very soon, so we've got to use them. On that, we have to wrap up. I will take time to thank each of you. Auntie Na, Dr. Na, thank you so much.
Pleasure.
My two pharmacists from Ad Pharma, right? Did you want to say something?
Yeah, before
very
we go.
Quickly, very quickly.
Concerning the guy who called for, I think, insomnia.
Yeah.
Yes, walking into any good pharmacy, ask to speak to a pharmacist. We've got sleep aids that could help you.
All right, but his insomnia must be assessed.
Yes.
Before you
that's
give
true.
him an aid.
That's
Okay, right. Great stuff. Right. And Dan, you wanted to say
All right.
something?
One thing that hasn't been mentioned:
Quickly.
insurance, health insurance.
Health insurance.
Don't forget, if you don't have a health insurance, try and get one.
Okay.
If something happens, you may never know. It helps.
All right, great.
So whether government, whether private, at Pharma, we accept NHIS at Kolebu.
All right.
And we also deal with all the private insurances.
All right,
So
great.
yeah.
Okay, add them to your your resolutions. Right, so many thanks, Dr. Na, Obodai, and Daniel Sapon from Ad Pharma. Many thanks to you, and greetings to your boss. And many thanks, Reverend Osofo Ernest Enimopari, who has left Tottenham because Mourinho went. But thanks for joining us. We'll get back to you next week. We're still in business. It's a great new year. You have 365 days to write your book. What are you writing on each of those pages? And are you healthy and in good, should I say, health to make sure you're writing a great book? So many thanks to Abeku Sankofi, and I'm glad you crossed over with me. And many thanks to our discerning listeners for staying with us on Joy 99.7 FM. We're here for you. I go over to another excellent program, Sunday Rhythms with Bile, my senior brother. Stick and stay.